part of the Philips Global Innovation and Research Department itself. We have erected in 2014 here the Innovation Hub, which is a massive investment from Philips to really place an innovation hub over here. Currently, how many people we have, Edine?
We have 40 together with the business development and the research scientists, user researchers.
40.
All the areas, yes. 40.
Yeah. So we have 40 permanent staff over here really developing about this product. This is one of the products. There are many more being developed, which already has a massive investment from Philips when it comes to really addressing the topics in a low resource setting, especially in Kenya. It's also very good that we have this hub here in Kenya because it really also addresses the importance of Philips to the Kenyan market, the investment and the trust we have in the Kenyan market as well to roll it out mass scale. That's why we also tested it here in Uganda and in Kenya to really see how is this device working on this setting here in Kenya, for example. So we have addressed it with many clinics. You saw a picture in Kisumu, for example, in dispensary. Many of the clinics were having this device for testing purposes. So all those site visits, all this site perhaps one again represents quite an enormous amount of investment for Philips to really bring this product now to the next level. This is a global launch, a pre-launch when it becomes commercial available next year. So it's not only for Kenya, it's for global use. India, Asia in total, Africa in total as well. It's not only Kenya, it's actually global launch and we're actually doing it from here, simultaneously with New York and India at the same time as well.
And this is only Kenya. I mean, if we talk about the globe, we are talking about nearly 1 million. That's a huge number, 935,000. And many organizations are indeed active, but you also have indeed that role to play that we need to create that awareness. And certainly when we talk about something preventable.
So today is that World Pneumonia Day. So this is really making awareness. So I think it's also good for you as the press to help. It's something which is not actually penetrating the skin or anything like that. It's really on top of the skin with a Velcro belt as well. So very comfortable for the baby or the child as well to wear. It does not have any interaction with the child itself. So it does not have any adverse effects. It's just a diagnostic device. So it really helps everybody to make sure that anybody, a child or a small kid is really being diagnosed in the proper way. The fact is that, like Edine said before, not so much of treating the disease because medication is available. And we found also in Kenya that many medications and drugs are available in the market. However, the diagnosis is not being done properly. And hereby we are solving the problem of diagnosis in a very effective and affordable way. So every hospital, clinic is able to afford such a small device to help them to detect the disease in an early stage and treat the child accordingly. From many organizations like the United Nations to really address this kind of disease. The exact effect at the moment cannot be determined, but we really see the total scale. Like what Edine said before, 50 children a day dying from pneumonia, which is preventable. So if we can really prevent already this kind of disease from happening or even being not being treated, the impact can be tremendous. Tremendous on mother and child care, and especially the child care in this case, under 5 mortality. I cannot give any details on percentages, kind of things, because then we need to go really into the live setting and mass rolling out kind of things. What we've seen is in the research is from all this testing which we did in the field, it had a dramatic effect on the improvement of the child health. A dramatic effect. It really helps incredible amount of diseases being detected in the early stage, which otherwise might have been undetected.
And it's also called, and this is only Kenya. I mean, if we talk about the globe, we are talking about nearly 1 million. That's a huge number, 935,000. And many organizations are indeed active, but you also have indeed that role to play that we need to create that awareness. And certainly when we talk about something preventable. So today is that World Pneumonia Day. So this is really making awareness.
So I think it's also good for you as the press to help.
Where you collect indeed vital sign information. And what you need to do here is you look to the, normally what you do visually is actually being interpreted in a smart way in the device itself. So normally you look to a child and to the chest movement and the indrawing, and you count. So it is a visual and manual action. And what this does, it has an accelerometer and smart algorithms in it, and they turn that into an accurate counting. And that's for under 5. And indeed for the other age, so beyond 5, indeed, we have other solutions for that as well. But where we see indeed the challenge, and living, let's say, in 2015, and we have pneumonia as killer number 1 is a real shame for us, actually, that we really need to take action there.